originally, it started out, I've had MS for about 20 years now, and I've done a lot of things to try and assuage the problems that I'm having, which are principally dizziness and lack of mental clarity and that type of thing. Peripheral neuropathy is another aspect. And I've done all sorts of things. I did the liberation treatment. It didn't really do much for me.
You had the CCVSI done?
CCSVI, yeah.
And what was that, once or twice?
3 times.
3 times?
Yeah.
Okay.
Yeah.
And how did you find the results of the surgery?
In the immediate sense, on the first one, it was quite good.
Mm-hmm.
And I thought that there was something to it. About 5 days later, I started going back to the way I was. So I presumed that I just had an immune response to the invasion of my with the procedure that they did, and so that was kind of disheartening. And so I continued to look and look and look to see what I could find to help myself. And I came across a fellow who was talking about NUCCA, and it sounded reasonable to me, and being that there is a blood flow problem in the brain with the CCSVI aspect of it, and they had cleared that, I thought, well, what other thing could be wrong? And so I started thinking about the arteries and veins, the vertebral arteries and veins, and then I came across the NUCCA thing, and it made perfect sense. So I actually became a little bit desperate to have the treatment because I thought that it really added up. And so I found you. I was referred to by this doctor in the States. I can't remember his name right now.
Was that in Los Angeles?
No, I'm trying to remember. I think he was actually, he was on the East Coast somewhere. Might have been
New York.
It might have been New York, yes, I can't remember. And I'm trying to think of his name.
Did you have surgeries in the States or in Europe?
I had 2 surgeries in Poland and then 1 in New York City, in Brooklyn. And the fellow that did the surgery in Brooklyn was on the cutting edge, but it just didn't solve the issues. And so since I started seeing Dr. Foran and having treatment here, I have noticed a steady increase in my, or a steady improvement rather, in my balance and mental clarity, which might not be showing up so well at the moment. But yeah, generally I'm having good responses to the treatment. So.
And was there any changes in pain patterns or paresthesias, numbness, tingling, pins and needles, headaches, anything like that, visual disturbance?
I would say yes to the visual disturbance and to the pain aspect. I had quite a bit of a problem upon turning laterally with grinding, and sometimes my neck would actually lock, and that's been going on for over 30 years, and that seems to have abated significantly, and I don't, when I turn my head now, I don't feel any abnormal grinding. There's a little bit of it, but I'm also 51 years old and there's wear and tear. So,
what would you say to people who have been diagnosed with MS and are considering the CCVSI procedure, or maybe considering something else like NUCCA?
I would say save your money and do not pursue the CCSVI treatment at this point, and it is basically $10,000 a shot, and that's a lot of money. And I think that NUCCA is more effective, and I also know it's much more affordable. I think that I'm essentially spending about $1,200 a year on NUCCA, so with the money that I've spent on CCSVI treatments, I could have 35 years of NUCCA treatments, and I think more efficaciously in the long run. I would discourage people from spending their money on the CCSVI. I think it's a blind alley, and I think that the NUCCA treatments are very beneficial.
Okay. Anything else you want to add?
Well, if you do decide for NUCCA treatment, I highly recommend Dr. Foran.
Thanks, Kerry.
Thank you, Doctor.
Much appreciated.
For everything.
Thank you.